Dr. Vuong, let's talk about missing teeth. And let's talk missing teeth in the back. You know, where it's not visible, because a missing tooth in front, all of us, we run to a dentist and we get it replaced by hook or crook. We'll probably rob a bank for doing so. But in the back, not so much. We kind of feel nothing bad is happening. It's all right. And we get used to it after a short while of that hole in there. And you can see that I talk from experience. And yet dentists like you keep telling us that all hell can break loose if we don't fix it. Can you tell us, can you shed some light on it, of like, what is this discrepancy? Why do you guys say we need to fix it, and as patients, we really don't seem to seeing much of a problem with it?
Well, a lot of times when patients come in and they have a very broken down tooth, and I have no choice but to recommend an extraction, I always give them several options in order to restore it and replace the missing tooth. And the reason is, number one, besides this, the fact that you're going to be missing a tooth and it doesn't look nice, it can also lead to some severe migraine headaches. And
migraine headaches, huh? And why would that be? Why would that be? Tell me why that would be.
Well, migraine headaches comes about when you're missing that tooth. You're going to start to get drifting of the adjacent tooth, and also some super eruption of the top tooth. So you have all this.
A super eruption, meaning the tooth where the tooth which is above the one which is missing simply kind of comes down.
That's right.
Okay.
Yeah. So basically, you have all these teeth that are kind of searching for this missing tooth, and in doing so, it's kind of, you get adjacent teeth that are tipping over, and then you have the tooth that's on top that's kind of growing downwards, searching for this missing tooth, and all that causes malocclusion, which is a bad or uneven bite. And that's what can lead to the severe migraines.
So you're telling me the jaws, the upper jaw and the lower jaw get out of alignment. The hinges back there, somewhere along the line it all shifts. It doesn't fit together anymore. Like a good set of cogwheels, like a Swiss watch, it fits together perfectly. But this one, and teeth apparently supposed to fit as perfect as a Swiss watch, I've heard, and this one doesn't anymore if you have missing teeth. It eventually gets out wacko.
Yeah, that's correct. You know, so the whole chewing system, the whole system of our teeth kind of get out of line and throws off our bite, and which can cause the migraines and muscle ache and backache, neck ache, all sorts of aches.
So what you're telling me is, because most of us have heard many times that if you lose a tooth, you don't chew all that well, and I'm sure that has its own implications with, if food is not digested well in the stomach, if the stomach, basically if you eat rocks and the stomach has to work super hard, that's like you carrying, a backpack around all day long, all the time, and it's just not good. So I got that. But it looks like that this is an additional thing which many people don't know. I at least for a long time didn't know. Back pain, shoulder pain, and headaches. Because once those happen, the lifestyle is really, never mind the bad digestion, what that can give us, cancer, all kinds of stuff maybe. But here you're having headaches and shoulder pain, and I know that sometimes when I have it, which is, thanks God, very rarely, neck pain, stiff neck or so, that day is not comfortable. You're not productive that day.
Yeah, no, that's definitely true. I mean, if you're having all these problems from from the simple fact of having a missing tooth, it's well worth it to do all you can to try to save the tooth if you can, and if not, definitely replace it with a bridge or an implant or a partial denture.
Got it.
Spending a little bit of money now is a lot better than going through all the bad health that leads to bad health.
Right. Because, obviously an ounce of prevention is worth a pound of cure, so that's why obviously trying not to lose them in the first place. Is it also true that because of the missing teeth and shifting, it's more difficult to floss, brush, and because of it, perhaps even gum disease can potentially be easier caught than otherwise?
Yeah, definitely. When you have a missing tooth, like I said earlier, the adjacent teeth kind of tip over, and so you have these tippy teeth that, it's like a big food trap. And if you're getting food trapped around your teeth, and you don't clean it out properly, then that leads to gum disease.
I got it. And you have mentioned in other videos how devastating that is, so we don't need to repeat that anymore. All right, it's again not about losing more teeth alone, but it's about kidney failure, liver failure, premature babies, name it. You really pointed it out very well the other day. On the other video. All right, well, so here you have it. So basically, but that whole problem doesn't necessarily come overnight. So, it's not like bleeding from your arteries out here that you have to run right away. But at the same token, you shouldn't wait too long replacing your missing teeth either. Is that correct, that statement?
Yeah, that's definitely correct. Dentistry is kind of a lifetime thing. It's a gradual process. It's not like once you start once you start to lose your tooth, you don't get it right away. It's just a gradual process over time where the teeth start tipping over. Your bite starts to feel a little bit different. You're starting to feel some muscle aches and migraine headaches, and it just little by little it starts to come.
Right.
It definitely doesn't come overnight.
Right, and those are the insidious diseases or anything, it's like little by little we start making less money, little by little we exhaust our whatever it is, and it's just not good. And when it hits bottom, so to say, if there's such a thing, it's really an ugly sight. So it's better to fix it. And, you keep forgetting it because it doesn't bother you today, so you have a long time to fix it. And that, of course, will make it being shoved under the table and forgotten. All right. So it's all right. Well, let me ask you this. If a person has headaches, shoulder pains, neck pain, maybe even lower back pain, as you, I think, mentioned, and whether he has missing teeth or not, because I'm sure this misalignment can happen from many other reasons, teeth being grown badly in the first place, maybe a whiplash from a car accident, or the school teacher hit him too hard on the head in the back, so it gets all out whack, something like that. So if a person has headaches and stuff like that, would it be wise for him to maybe consult a dentist, especially if he already has tried other doctors and it somehow doesn't seem to get away, to see whether it is malocclusion, as you called it. It is a misalignment of the jars, or it isn't. If it isn't, fine, you can keep looking, but maybe it could be fixed. Is that something you would suggest?
Yeah, definitely. Misalignment sometimes can be a simple fix. It can be as simple as making some simple adjustments to a few of the teeth, or sometimes it takes a little bit more than that. It takes doing some crowns and bridges to try to straighten those teeth and align the teeth that are still there. And sometimes it even takes like doing some orthodontics.
I got it. Well, all right. Thank you very much for your wonderful explanation, Dr. Vuong. I'm sure I'm at least happy. I learned something more again, and I'm sure patients out there and people out there will appreciate it too. Bye-bye.
Thank you very much.